Our company is RightEye. We use eye tracking technology to be able to assess your health and wellness. So based on your eye movement behaviors, we can detect things like Parkinson's or a concussion or autism. This particular test I'm going to show you is for autism. So what we do is we have a 60-second video, and on one side of the video is shapes, and on the other side of the video is faces. And children between the ages of 12 and 40 months are always interested in looking at faces, except if they have autism. And when they have autism, they're interested in looking at the shapes. We measure how long they're looking at the shapes compared to the faces. And if they're a child with autism and they spend 70% of the time or greater looking at the shapes. If they are a child without autism, they spend 50% of the time or greater looking at the faces. And then between 50 and 70% of the time, if they're looking at the shapes, then that means they're on the spectrum. There's a lot of science behind these tests. This particular test has come from the University of San Diego with Dr. Karen Pierce. In which she's done a lot of peer-reviewed research on children of this age group and autism. Our Parkinson's test has been part of a 12-year project with 6,000 participants, looking at not only Parkinson's but differentiating between other movement disorders such as an essential tremor. We have reading products where we look at where a person is reading and the research behind that to determine things like dyslexia. And then other tests such as concussion tests where we have 25 peer-reviewed articles that we base the tests off of.